Hey there, it's Dr. Jim. Thank you for spending some time with me on CBD and bone health. That's my topic for today. So, bone loss. Why am I concerned about this? Bone loss is a part, to a degree, of the normal aging process. Acceleration of loss in bone mass coincides with a decline in estrogen among females and testosterone, although at a slower pace, for men. Research has identified an important relationship between the body's endocannabinoid system and bone biology. I find that fascinating. The endocannabinoid system and our bone biology have a relationship together. Specifically, this system influences bone formation, mass, and structure. Because older adults are at increased risk of osteoporosis and other musculoskeletal disorders, CBD might be beneficial in maintaining bone health. So that's a big takeaway from the video today. Let's talk about the endocannabinoid system and bone health, because that's where the information really lies. Researchers from Colorado and Pennsylvania have found that the quote, endocannabinoid system is involved in bone metabolism, end of quote. And this, quote, emerged from experimental observations that linked the CNS via endocannabinoids to regulation of bone growth, end of quote. Isn't that fascinating? So cannabinoid receptor CB2 is highly expressed in bone cells. CB1 is as well, but to a lesser extent. And this has a direct influence on the health of the skeleton. Two other molecules present in the endocannabinoid system, anandamide and 2-AG, are also present in the bone microenvironment. So let's look at results from in vitro as well as animal studies when it comes to CBD and bone health. And I have to admit, while human studies on CBD, the endocannabinoid system, and bone health are lacking for the most part, there's a good deal of evidence from in vitro and animal research. Some studies report that CBD's influence on the endocannabinoid system leads to several things: increased porous bone, increased bone mass, increased bone absorption, decreased bone mass, increased bone strength, and increased cortical bone. So, cannabinoids given to mice with age and trauma-related osteoarthritis of the knee in particular resulted in a reduction in damage to the joints. So they were happy little mice. Similarly, rats who were given CBD for bone-related problems showed enhanced fracture healing and reduced bone loss. That's pretty interesting stuff. So ultimately, research might be trying to create drug targeting of the endocannabinoid system. And what I mean by that is this: while there exists a plethora of prescription, over-the-counter, and alternative treatments for bone conditions, CBD and other phytocannabinoids are being viewed as a serious pharmacological solution for improving bone health. CBD is already well known to have anti-inflammatory effects, for instance, on inflammatory arthritis, by cross-talking to numerous bioavailable targets in the endocannabinoid system and throughout the body. So here are some of my final thoughts on CBD and bone health. Is it possible that a new and effective way to prevent or treat bone disorders lies within the endocannabinoid system? Well, more time and more research will tell. What we currently know is that CBD and other phytocannabinoids go to work acting as tiny little molecular keys that open up various channels in the endocannabinoid system, allowing them to work better to reduce inflammation and pain, including the various types associated with osteoarthritis and with musculoskeletal disorders. I'm Dr. Jim. I hope you keep coming back. I keep writing articles on CBD and tons of physical, psychological, emotional, neurological conditions, and hopefully researchers will find answers to a lot of human problems in the future using CBD. Thank you for watching the video, and I'd like to show you my new book, Living Longer and Stronger with CBD. It took me about a year and a half to write as I scanned hundreds of articles in prestigious journals, peer-reviewed medical studies, examining the effects of CBD for various physical conditions, emotional and mental issues, and neurodegenerative conditions. And I condensed all of those findings into one book. I believe that there's something in here for everyone. So if you're interested, follow the link to the book on Amazon. Thank you so much.